Welcome to the Benefit Orientation Overview for the Carpenter Health Network for the plan year beginning January 1st of 2026 through December 31st of 2026. This is Don Massett of Massett O'Lind Benefits Consulting. Over the next few minutes, I'll be reviewing some of the upcoming changes to your benefit plans and costs for the new plan year. Our office is available to assist you with questions regarding your benefit options, claims, prior authorization requests for medical services or prescriptions, and member ID information related to your coverage. Cheryl Irwin is your dedicated Senior Account Manager at Massett O'Lind. Please don't hesitate to contact our office or your HR department for assistance. Contract and policy information can be found on page 4 of this benefit guide. For current employees that are enrolled as of January 1st of 2026, open enrollment applies to the following benefits: health, dental, voluntary vision, voluntary hospital indemnity coverage. You can establish a health savings account if you're enrolled in Health Plan Option 2, which is a qualified high deductible plan. And for this open enrollment period for January of 2026, you can also enroll in voluntary life, voluntary short-term and long-term disability through the standard insurance company. We are changing to a new insurance company for life and disability due to a significant rate adjustment from Symetra. So if you've waived these benefits previously, you now have an opportunity for January 1 to enroll in these benefits. First-time benefit elections or changes will take effect January 1st of 2026. Newly eligible employees hired throughout the plan year, your benefits will become effective the first of the month following 30 days of full-time employment. You can also enroll in health, voluntary dental and vision. You can establish a health savings account if enrolled in the high deductible plan option 2, voluntary life, voluntary short-term and long-term disability, and you can purchase voluntary hospital indemnity coverage and other supplemental benefits. Your benefit elections will begin the first of the month following 30 days of full-time employment, as mentioned. Now, as a reminder to all employees, if you wish to waive coverage for you or a family member when newly eligible or during open enrollment, you will not have an opportunity to enroll until the next open enrollment period, which is January 1st of 2027. If you experience a qualifying event during the planned year, you will have 30 days from the date of that event to make your elections. And of course, we have examples listed here in the middle of page 5 of what qualifying events are and the time frame for you to make an election following the loss of credible coverage or when an event occurs. So for this year, everyone, the Carpenter Health Network will be changing to a new health plan administrator from Blue Cross to 90-degree benefits. Now, if you've been employed with the Carpenter Health Network for a few years, you may remember the previous third-party administrator, IMA. Their name has now been changed to 90-degree benefits. They're very familiar with the Carpenter Health Network, and 90-degree benefits had done a great job for the Carpenter Network for many, many, many years. Your pharmacy benefit manager will be Lavinity effective January 1st. And again, the pharmacy benefit manager will be replacing Express Scripts, and now it will be Lavinity. Of course, you can utilize all of the pharmacies that you could access previously, be it Walgreens, Rite Aid, CVS, Target, and Walmart, and any other pharmacies that were in the Express Scripts contract. Now, with the Carpenter Health Network, we'll continue to offer 3 health plans. Plan 1 will continue to be the same PPO plan that is currently available. Your network will now be the Aetna National Network, and again, Lavinity is the pharmacy benefit manager. Plan 2 will continue to be the qualified high deductible health plan where you can establish a health savings account, and again, you can utilize the Aetna National PPO network. Plan 3 will also continue to be the same plan design, which is a PPO plan with a higher deductible, And again, that network is also the Aetna National Network and Lavinity Pharmacy Benefit Manager. Now, this year we've removed the drug deductible starting January 1st on Plan 1 and Plan 3. There will no longer be a $250 drug deductible starting January 1st for Plans 1 and 3. And that deductible did apply to all covered family members. And we also have some good news that the employee cost share, Plan 1 rates will be reduced in all categories, and Plan 2 employee-only costs will remain the same with a slight increase to the dependent cost. Plan 3 employee costs will increase in all categories. Now, for the implementation, we have already submitted an electronic file to 90 Degree Benefits, the administrator. And everyone that is currently enrolled in Plan 1, 2, and 3 with Blue Cross, we are going to enroll you in the comparable Plans 1, 2, and 3 through 90 Degree Benefits. You will receive an ID card based on your current election. However, during the open enrollment process, if you choose to change plans, you'll just receive a second ID card. But the good news is that your member ID number is going to be the same. So we've already migrated everyone to the comparable plan based on your current election, but you most certainly have an opportunity to change from that plan during this open enrollment period and just receive a second card. The dental and vision benefits will renew with Humana. There was a slight rate increase on the dental, but it was still a very reasonable rate for the benefit. And there is no rate change or benefit change on the vision program through Humana. Now, Symetra issued a significant rate adjustment on the voluntary life and disability program. The standard insurance company has come in with comparable benefits and much lower rate adjustment. And in some instances, the rates were very close to current. Some, the rates were a little bit higher, but still not nearly as high as the Symetra increase. Now, all employees that had previously waived voluntary life and short-term and long-term disability, you will now have another opportunity for this open enrollment to enroll in these programs on a guaranteed issue basis with no medical questions. So this is your chance to pick up this great benefit. Now, for short-term disability, the benefit will be based on 60% of your earnings up to $2,500 a week for a 13-week period. Previously, the maximum benefit was up to $1,400 a week, and in the previous contract with Symetra, you could also purchase a lesser amount of weekly benefit based on your needs. This contract is just going to be straight up 60% of your earnings, up to $2,500, payable for a 13-week period after you meet the waiting period. The long-term disability benefit, you will have two choices. You can purchase a 40% of your pre-disability earnings at a lesser cost, or 60% at a higher cost for the higher benefit for disability. And we'll touch on that here shortly. So you'll have two choices, which will help you better manage your cost. Your indemnity program, which is the hospital indemnity plan with Symetra, will remain in place for the Carpenter Health Network for you to keep and or elect. Now let's start with Plan 1. As I mentioned, there is no more drug deductible. So starting January 1, you'll pay up to $15 for Tier 1, up to $40 for Tier 2, up to $70 for Tier 3, and you'll pay no more than 30% of the cost of a specialty medicine, not to exceed $150 for the prescription. Your co-payments will continue to be $30 copay for physician, $60 for specialist and urgent care. You will also continue to have a co-payment for physical therapy, as well as X-ray and lab is covered for a $40 copayment. Your deductible is calendar year, $2,500 deductible, which applies to a hospital admission, an outpatient procedure, or a diagnostic test, such as an MRI or CAT scan. Once you or a covered family member reaches the deductible, you'll be covered at 30%, and you'll pay 30%, and the carrier will pay 70%. Once your 30% reaches the out-of-pocket limit of $7,500, which includes your deductible, your coinsurance, and all of your co-payments. So the maximum out of pocket during a claim year in a calendar year is no more than $7,500. And again, if you have family members covered, once one family member reaches the deductible, they're covered at the 70/30 coinsurance level. Again, 9 Degree Benefits is your plan administrator, just like Blue Cross was, and Aetna is going to be your national PPO network. And the SVC will also show you that you do have in-network and out-of-network coverage. But the Aetna network is very vast and very comparable to Blue Cross and gives you that national presence in all these other markets, such as MD Anderson in Houston or the Mayo Clinic and many, many, many more. So that's plan one. Plan two is the qualified high deductible plan where you can have a health savings account. Now, you keep in mind that if you enroll in this plan, you must meet a $3,000 deductible before anything is covered. That includes doctor visits and or prescriptions. Now, if you have a lot of ongoing medical conditions, chronic medical conditions, and take a number of medications that could be high cost, this plan might not be the best suited for you because even at the discounted rate through the Lavinity Pharmacy Agreement, you may hit that deductible very, very quickly based on a specialty medicine or the cost of one. So we would urge you to consider Plan 1 or Plan 3, where you get that first dollar coverage in the way of a copayment for those medications. However, once you meet the deductible of $3,000, then you'll pay 30% at the discounted rate with Aetna for doctor visits, and you will pay $15 copayment for Tier 1 medicine, and you'll pay 50% of the discounted rate for Tier 2, 3, and 4 medications once you've met the deductible. Keep in mind that your maximum out of pocket is $6,000. So your deductible and your coinsurance and all of your spend will not exceed $6,000 during a calendar year for covered medical services. Lastly, the Plan 3 is a higher deductible PPO plan versus Plan 1, same network, Aetna, and the deductible is $4,000 versus $2,500, and the out-of-pocket limit is $7,800 versus $7,500. This plan has higher copayments for doctors, specialists, and urgent care. You also still have a copayment for physical therapy, even though it's a little more than Plan 1. And you have copayment for your x-ray and lab. Your prescription benefit, let me point out that you'll see that the copayment tiers are 15, 40, 70, and no more than 300 for Tier 4 medicine versus 15, 40, 70, and no more than 150 for Tier 4 specialty medicine. So you don't pay more than 300 for a medication that's specialty versus no more than 150 for that medication under Plan 1. And the deductibles are going to work in the same fashion as we just explained on Plan 1. If your family member or you meet the $4,000 deductible, then you're covered at 30% and 70, and that's where you pay 30% coinsurance until your deductible, your coinsurance, and all of your copayments reach the $7,800 maximum calendar year out-of-pocket limit. So you have 3 great plans to choose from and an improvement to the prescription program where you no longer have to satisfy the drug deductible. Now, the subsidiary of the Carpenter Health Network is Homedica, and other than the state of Florida, all other states can enjoy telehealth services by way of Homedica house calls. So if you have minor medical issues and you don't want to have to go wait at a doctor's office or an urgent care facility 7 days a week from 8 a.m. to 8 p.m., you can have a physician contact you through Homedica to go over your medical issues and prescribe a medication when applicable. Now, if you're in Plan 1 or 3, you'll be assessed a $30 copayment that'll be deducted from your paycheck. Very convenient. If you're in Plan 2, the copayment will be $50. So we would urge everyone to take time to really get familiar with this program, because having a doctor available to you 7 days a week from 8 a.m. to 8 p.m. would be significant in helping you manage those day-to-day common medical conditions that are non-emergency type medical issues. Now, I mentioned to you earlier that your new plan administrator is 90-degree benefits. They're just like your customer service would have been at Blue Cross. They were previously your plan administrator. So, like Blue Cross, 90-degree benefits has a mobile app. You can view your member ID card, contact them, as well as our office, of course, when you have questions regarding a claim issue or you have an issue with your member ID. Or there's a matter that you just need to discuss that something's not quite working out between what a provider's telling you and what you know of your insurance. And of course, you have our team here at Macedolin to assist you as well. So we'd urge you to load the mobile app for 90-degree benefits. And look, a copy of your ID card is going to look similar to this here. You'll see the Carpenter Health Network, Aetna is your national network, and Lavinity is your pharmacy benefit manager. And that's replacing Express Scripts, who was the pharmacy benefit manager currently through Blue Cross. Now, you can also, of course, as mentioned earlier, you can access the Aetna network to look up all the providers. But again, Aetna is one of the largest national PPO networks in the country, so we shouldn't expect you to have any disruption or concern there. You can also load the Lavinity mobile app, and this will allow you to look up the cost of medications, what medications are available, which medications require prior authorization, and what tier they fall in. Now, we did request from Express Scripts a prior authorization list of medications. So once we get that list, we're going to submit that over to 90-degree benefits and Lavinity. So we can hopefully mitigate you all having to go through the pre-approval process again, having a medication pre-approved that was just recently approved. Now, again, if the pre-approval has expired, then you're going to have your doctor get it pre-approved, and you would have had to have done that whether we stayed at Blue Cross and Express Scripts or moved. And the online Aetna Access portal will also give you access to looking up providers as well, and the information here is listed for your convenience. So if you're in Health Plan 2, you can have a health savings account, and the IRS has increased the limits that you can contribute to the HSA account. So in the event that you have Plan 2 and you want to move to Plan number 3, well, you can no longer contribute to the health savings account. However, you can use the money in your HSA account to pay for doctor co-payments, deductible related expenses, and dental and vision. As mentioned before, your dental program is with Humana. There are no waiting periods for type 1, 2, or 3 services or orthodontia. What's great about this benefit is that there's a $3,000 annual benefit maximum for you and each covered family member. And preventative services do not count towards the $3,000 limit. So if you have 2 cleanings a year and the average cost of a cleaning is $120 to $140, let's just say it's $280 total, that does not count against the $3,000. Newly eligible employees or current employees for open enrollment, this is a very well-priced program for the benefit you receive. Now, if you don't use a dentist that's in the Humana network, the dentist will normally file the claim as a courtesy, verify your benefit. Humana will pay them at the highest reasonable and customary that they use, which is in the 90th percentile. But the dentist can balance bill you if there's any balances or differences left over. But again, this is a very high reimbursement rate contract, even for non-network dentists. Your vision program through Humana is very well priced. Staying in network is very key. An eye exam is a $10 copayment, and that's worth well over $100. You have a great allowance for frames and lenses, and you get a discount if you spend more than the allowance on certain frames. And you also get a very generous allowance on elective contacts as well. And again, you can get a discount on anything over the $130. So we'd urge you to take time to look into this program. It's very, very affordable for you and your family, and Humana does a great job. You can also load the Humana mobile app. Now, this will give you access to your dental and vision benefits, as well as your member ID card accordingly, and you can look up a list of the providers available in your area. So, for current employees that have waived the voluntary life insurance when it was previously offered, or if you're a newly eligible employee hired throughout the plan year, you can elect up to $250,000 of life insurance on a guaranteed issue basis in $10,000 increments. You can purchase $25,000 on your spouse as long as you have at least $50,000 on yourself and $10,000 on your kids. So this is an incredible program, and this program is also portable at the rate that you pay. Now, if you do not elect voluntary life when it's initially offered to you for this one-time open enrollment, or if you're a new hire throughout the plan year, there is no future open enrollment. So let me be clear. This is not a benefit you can just waive and expect to enroll in next year. You can buy the benefit in $10,000 increments, which at least you don't have to worry about buying $250,000 if what you're looking for is $60,000, $70,000, or $80,000. So take time to look at those rates, and we want everyone to re-elect the benefit that it makes the most sense to them during this enrollment period. We did not carry over your current election because you may want to buy the same amount or more or less. Now, voluntary short-term disability is available to all current employees, again, if you've waived the benefit previously, and it's available for newly eligible employees during your new hire period. This is a guaranteed issue benefit with no medical questions. However, there's no future open enrollment if you choose to waive it. This benefit will pay you 60% of your pre-disability earnings, up to $2,500 a week for a 13-week period after a 7-day accident or injury waiting period. So again, let's be careful that we don't pass up this enrollment. And for current employees, if you were in the program previously, we did not auto-enroll you. So please re-elect the benefit to make sure that this is something that you're comfortable with. Keep in mind, if you had the short-term disability before with Symetra, you may have purchased a lesser amount of benefit for a lower premium. This is just a one option selection, and the premium, we didn't feel it was appropriate just to auto enroll you because I'm sure the premium is going to be more because the benefit would be more than what you may have purchased. So at least take time to look at the cost before you rule it out. Long-term disability will be, again, through standard, and you have two choices, everyone. Plan 1 is a 40% benefit of your pre-disability earnings, not to exceed $10,000 a month, payable after a 90-day elimination period to normal Social Security retirement age, or you can have a higher benefit at 60% of your pre-disability earnings, up to $10,000 a month, payable after a 90-day elimination period. So you have two choices. With Symetra, you also could have purchased a lesser amount, but the standard contract does not work that way, but you do have a choice of paying a 40% benefit or a 60%. So for newly eligible employees and current employees, if you waive the benefit when it's initially offered, there is no future open enrollment. Employees will have the opportunity to continue their benefit through the Symetra Hospital Indemnity Program. Newly eligible employees can pick between one of two plans. This gives you some additional coverage through reimbursements based on a hospital confinement, intensive care, substance abuse facility, and more. So we would urge you to take time to look at this program. It is a guaranteed issue benefit, and this program is giving you the extra dollars that you need when you need them the most. Now, you'll also have opportunity, everyone, to purchase additional supplemental benefits through Boston Mutual and Allstate. If you have any questions regarding those benefits, you can contact the Clements Insurance Agency at the number listed here. The anniversary date for those programs is every September. Your retirement benefit and 401k is administered through Transamerica. You will be notified when you're eligible to enroll. And just to keep in mind that we have Some information here on the maximum amount that you can contribute and the vesting schedule accordingly. Now, with the standard insurance program, you all have the opportunity to have access to a EAP program. That stands for Employee Assistance Program. Now, this benefit is available to you 24/7 on a confidential basis. And I want to repeat that. This is a confidential program. If you're dealing with depression, grief, loss, dealing with marital issues or a family member, addiction or drug abuse, you can speak to a licensed guidance counselor that can assist you with getting to the right resources and helping you work through these issues. Again, this is confidential. Neither does our firm, Macedo Lind, or the Carpenter Health Network get any information from anyone's utilization to this program, and it is, again, confidential. And it's available to you 24/7. And of the additional resources listed here, some information that you can find helpful. Now, during your open enrollment or during the enrollment as a new hire, if you have any questions, please don't hesitate to contact our office. We're here to assist you. Once you've completed the enrollment process, load the Ease mobile app. This will give you access to your benefit elections 24/7. Now, I know that we have a lot of things going on this year for open enrollment, and I want to mention to you one more time for current employees that if you were previously in Plan 1, we've already moved you to the new Plan 1 with 9-degree benefits, Plan 2 and Plan 3 as well. And if during open enrollment you choose to make a change, you'll just receive a second ID card. If you don't make a change and you just re-elect Plan 1, which we need you to, then you'll have your ID card, obviously, that will be based on that election. So again, everyone, we are a little bit later for open enrollment this year than normal. Next year, it will be much sooner, but we had a lot of things to get in order before we could launch open enrollment. But this was a good move. 9-degree benefits is very flexible and can help us with other service features going forward. And this will be a benefit to the Carpenter Health Network as a company, as well as to you all. Again, my name is Don Massett, and if you have any questions, we are here to assist you.